tuned in to the Community Cats podcast. Ready? Let's go.
Welcome to the Community Cats podcast. I'm your host, Stacy LeBaron. I've been involved helping homeless cats for over 30 years with the Merrimack River Feline Rescue Society. The goal of this podcast is to expose you to amazing people who are improving the lives of cats. I hope these interviews will help you learn how you can turn your passion for cats into action. And today we are speaking with Dr. Angie Krause and her veterinary nurse, Jojo Smith. Dr. Angie is a holistic small animal veterinarian in Boulder, Colorado. She believes that cats are underserved and deserve more from veterinary medicine and society. At the heart of her work is a simple mission to empower you to be a knowledgeable and confident advocate for your cat's health and happiness. She's recently launched the podcast, Tales of Truth, the Truth About Veterinary Medicine, with her veterinary nurse and co-host, Jojo Smith. They tackle important topics for anyone who has an animal they love and care for. Dr. Angie, I'd like to welcome you to the show.
Thank you so much. So happy to be here, and it's good to see you again.
Yeah. And Jojo, welcome to the show.
Thank you, Stacy. I'm happy to be here.
Yeah, this is going to be a great conversation. Before we hit the record button, I've been sharing how I've been binge listening to the podcast, and I think it's fantastic. And from one podcaster to another, I just think it's an incredible show and really appreciate the effort and time that you put into that show. Dr. Angie, can you tell us how you got to be so passionate about cats?
When I was 3 years old, my mother took me to the Humane Society, and we picked out 2 black kittens. And we brought them home. And when I took them to the vet clinic with my mom, I walked in and I just knew that this is what I wanted to do. And I loved those cats. And they really shaped how I felt about cats and my relationship with cats going forward. We were a family of cat people. And the compassion my mom held for cats in the neighborhood and the cats in our home was really inspirational. And so I've been a cat person ever since.
Fantastic. And how about you, Jojo?
I love a cat. I've had cats my whole life. And then I had a kid who's severely, severely asthmatic and allergic. So I no longer have the privilege of living with cats. So I live cats through work. And that's working with Dr. Angie, who has created platforms for cat people and the cats that they love. I just feel that's where I get to live it now.
Yeah, that's wonderful. I'm here in Vermont, but I live part-time here and in Switzerland, so I do not have cats in Vermont either. I have 2 community cats at our condo complex in Switzerland that we share with a variety of different folks who have been pet owners, and they travel and they come and go. So there's a group of us that take turns taking care of the cats over there. But here, because my life is so, I travel so much, the worries of having a cat at home doesn't work for me. But that doesn't mean I can't be a godparent to a lot of other cats. It doesn't mean I don't play a role in the cat world. And so when we think about, if you don't have a cat, you can't love and care for cats, that is just very wrong. And so, in understanding, thinking about us working together collaboratively to help cats, to make cats have a better life and have society understand cat better than maybe we do right at this point, I try to ask a lot of folks, what is your why? And I'd love to know, Angie, what is your why when it comes to cats?
My why as a veterinarian in general is the love that people have for their cats and the love that cats have for their people. And so every day I get up and I go to work and I help cats and their people and celebrate the love they have for each other. That human-animal bond is magic. And it's beautiful to see it go both ways. And even though cats have been unfortunately mischaracterized as aloof and misunderstood, my patients love their people. And maybe they don't do it in the ways that we would think that they should be loving them, but they really love them. And it's really a beautiful thing to celebrate.
Yeah. And you say it very beautifully when you're saying that they love each other in their own unique ways. I've had many semi-feral cats in my house. Some of them would be untouchable cats, but I certainly had a relationship with those cats. They loved my son when he was 4 years old. They approached him more than they would approach me because he didn't represent, oh, she's going to medicate me or she's going to try and do something to me. He was just this innocent little boy who loved cat. So the language that cats can speak to their loved ones is very different. So they would chirp and talk to me potentially, but they would be different with my son when they were younger. But then also there is that relationship that you see in the practice, or you've done home visits. You've also been in, a physical space. Jojo, you've also worked in clinics too, and in the home environment with home veterinary visits. How are those relationships and connections different?
That's a great question. I don't think that we get to see the genuine relationship in a practice setting because it's such a high stress situation so often for cats and their people, right? Because their people aren't wanting their cat to be stressed. In the home environment that Angie and I were able to see these cats, it's a whole different experience. It's the cat in their home environment is a different presentation of itself, which is probably a fuller presentation of itself. And I think that is the beauty in a home visit. It's just we get to see that bond, we get to see the relationship, we get to see the structure of a daily routine. And the cat in its own unique personality without the stress and fear of everything that comes with the practice.
I actually just had this epiphany, and I wonder if this is possible or if you've heard of this ever being done. So we have our home visit for our own cats. But what if there is somebody who is really a dedicated caregiver of community cats in their backyard? Say they have a group of 5 or 10 cats. They feed at a regular time. I mean, would a veterinarian ever be able to play a role in visiting those cats during feeding time just to give them a look over? Dr. Angie?
Absolutely. Yes. I mean, I think that's the nice thing about being mobile and having the ability to work outside of a clinic is there's a lot that you can ascertain just by looking at a cat. You don't necessarily have to touch them. Maybe they let you touch them, maybe they don't. But there are ways that we can look at their respiratory health. Do they have problems with their eyes? Did we think they have a chronic herpes infection? There are a lot of ways, like, are they underweight? And there are a lot of ways that we can evaluate them out in the field.
And Dr. Angie, based on your experience working in a variety of different practices, what is sort of the state of the community cat in Colorado these days?
Well, in Boulder, I'm not aware of a big community cat population. And I've been thinking about this, as we scheduled this podcast. We were having a meeting with our web developer who does a lot of TNR work. And she said, feral cat colonies are everywhere. You just need to look for them. And then I thought, is it possible that I've lived here for the past 18 years and not known that there's a community cat population? Or is where we are, we have a lot of coyotes. I think we have a lot of predators. And so we tend to not have a lot, at least here in Boulder County. But I think in different parts of Colorado, maybe Denver, maybe Colorado Springs, we would have more. But we don't tend to have a lot here next to the mountains because I think we have too many predators.
Right. Well, and actually in one of your podcasts, you were talking about how there seem to be quite a few veterinarians in Colorado, and we have talked about the veterinary shortage on this podcast quite a bit because capacity for access to spay neuter appointments is really game-changing. If you're in what I would call a spay neuter desert, it's really challenging to be able to assist community cats. And if you are in a region where there is, I'm not going to say like an overabundance of spay neuter appointments or access to care, but if you're in an area where it seems like the demand is trying to meet the supply, then it would make sense that you don't have a significant overpopulation of cats that are visible that you see in the community. So, I don't know if you have thoughts on that, Angie.
Yes. Well, and I'll tell you, sometimes just trying to find, like if someone says, hey, I want a kitten, sometimes that's actually kind of hard to find here. when I decided I was ready for my next cat, it took me months. And I had to stalk the Humane Society's webpage. And that wasn't even enough. I just started going every day because the minute they would get a kitten, that kitten would be gone. And for adult cats too, it's not just kittens. And so I think we do have such an abundance of shelters and spay neuter facilities here that you're right. We just don't see that overpopulation. And I think that's the same with dogs here too. And for that reason, we actually experience an influx of animals. So we have animals from Texas, Oklahoma, New Mexico transported here because we have so many resources.
And that is happening in New England. And I honestly did not think we would get to the point where we were bringing in potentially more cats than dogs into some New England states, but we now certainly are doing that. We do have pockets, though, of areas that need support. And I think that there is a collaborative effort where we can work to try and do a little bit of moving around of the cats, but ensuring that the spay neuter resources are there. So again, this is this magical supply and demand conversation that's out there, and finding that perfect balance that works for all. Because I also think it's extremely important that anyone who acquires a kitten or a new cat, that it be spayed or neutered before adoption. Because I think that that starts the vicious cycle of, I call Adam and Eve, in having unfortunate, unplanned litters and that kind of thing. And so on that note, where you're in Colorado, you seem to have the cat situation somewhat in control based on the information that you know at this point in time. You do also, Angie, work at a high-quality, high-volume spay and neuter clinic. So what is that client like, and what is your perception from that clinic?
Oh, from the clinics that I do relief that do high volume spays and neuters, it's interesting. I think people that utilize these clinics really span from the social demographic to like an income demographic. I think everybody uses them. I think when a lot of people go to their general practitioner and want to get a spay or a neuter, sometimes it feels too expensive, and they know there's something available that's less expensive. And a lot of these clinics and programs do really high quality spays and neuters. And honestly, that shelter vet that can do like a massive amount in the day, like they're the best. No one's going to do a better spay or neuter than a shelter veterinarian. And so I think the demographic it really varies more than I would expect.
Yeah. And that's one of my concerns in a way, because I feel like when I started out in this field in the 90s, we worked with private practice veterinarians. I had 14 private practice veterinarians that did our surgeries for our cats and kittens available for adoption. For the cats we were doing TNR on, we were working with all private practice. We did not have our own internal clinic resources. And then we created a mobile spay neuter clinic, the Catmobile, and we had monthly MASH style clinics for cats and traps for TNR. And I don't know if we just moved the spay neuter appointments from here over to here, or did we really increase and build capacity? And Jojo, you're on the front lines. You've been on the front lines in a variety of resources. Have you seen some of these issues or concerns at the frontline level with regards to access to spay neuter?
Well, it's interesting because we just recorded a podcast actually this morning about spays and neutering. And something I was thinking about is I think we've done a really good job as a society of really getting the message out, spay and neuter your pets, right? Kind of how we did with This Is Your Brain on Drugs. Like that was a really effective marketing campaign back in the day. And so a part of it, I feel, is that as a community and a society, we do this for our pets, and people who maybe wouldn't have before don't. And the shift is happening. You're talking about these high volume spay and neuter clinics, and those used to be a big no-no. We just referred to them as chop shops, right? And so people were really afraid of them. So if they didn't have the resources, they just didn't do it. So I think there's a lot of positivity happening in the language and the accessibility and how we are educating the communities and providing more access.
Do you love crazy cat ladies? I do. The Animal Rights Foundation supports national rescue transports of dogs and cats, protects and rescues horses and livestock, and advances animal advocacy nationally. Become a member by visiting animalrightsfoundation.org.
It's estimated there are hundreds of thousands of cats living outside in New York City, over 500,000. And the wild thing? They've always been here, right underfoot. We just haven't been paying attention.
It is cats everywhere. I am very heartbroken.
It starts with one cat, and before you know it, is another one, and then one is really sick. I started making phone calls. Can somebody come pick them up?
Rain, snow, or shine. How they survive is beyond me.
Think about feeding 29 cats every morning. I couldn't afford to do that.
This isn't just a story about cats. It's about systems, about poverty, housing, burnout, and what happens when we're forced to build something better from the ground up. From Flatbush Cats, this is Underfoot, a new podcast uncovering New York City's cat crisis and how we can fix it together. Follow now wherever you listen.
In a recent study, 97% of respondents said that pets are family. Communities can play a vital role in helping to keep families together, whether it's reuniting lost pets with their owners, donating pet supplies or funds for pet owners in need, or offering short or long-term fostering. People can help keep pets and their people together. We just have to show them how. Did you know there are resources you can use to help bring attention to the programs you offer to help them do just that? From public service announcements, short videos, printable posters, online and social graphics, and much more. Find your resources at www.petsandpeopletogether.org/campaign-resources. #be a helper. Are you a proud cat parent looking for the perfect, affordable healthcare for your kitty? Well, look no further than the Community Cat Clinic, conveniently located in Woodstock, Georgia, just north of Atlanta and not too far from the Tennessee and South Carolina borders. The health and happiness of all cats are the top priorities at this feline-only hospital. From preventative care, spay, neuter, and vaccines, to specialized and innovative treatments like full-mouth dental, ultrasound, radio, iodine therapy, emergency blockage cases, they've got your cat's well-being covered. For the TNR community and local shelters, they offer easy-to-access, low-cost spay-neuter services and volume appointments. So if you want to do a large TNR project, this is the clinic you want to go to. It's worth the extra trip. Appointments are available most days. Check out the Community Cat Clinic online at communitycatclinic.com or visit them in person at the Walmart Shopping Center at the Shops of Trickham on Highway 92 at Trickham Road in Woodstock, Georgia. More per, less price.
I'd really be interested in understanding your thoughts, Angie. As a private practice veterinarian, do you feel that it is okay to say, okay, you go over here, get your kitten spayed or neutered, but then I'll be your primary?
Definitely. Yeah, so happy to do that. And I think in general practice, we understand that, maybe the kitty spay here is going to be $300 and you can go get it for $75. And we understand that. And so at least for me and the other practitioners I work with, no one's upset. We're happy it's being done.
But in turn, you don't feel an obligation that this is your client and you want to have this holistic relationship with the client where that client could pay a certain amount of money, and yet they're going to a clinic that might be taking somebody else's slot, that might not even be able to ever bring their cat to a vet like ever again after that.
Oh, I see what you're saying. Like they're using up that slot that someone that actually could not afford that $300 spay. Yeah, that's so interesting. And to be honest, we in private practice in Boulder, Colorado, to do a cat spay is almost unheard of because people are adopting their cats from shelters and it's already done. And so I suppose if someone were to get maybe a cat from a breeder or a situation where that cat didn't come to them sterilized, I could see how you would feel that maybe that's not the right thing to do from the group standpoint. And I think I speak from a place of privilege here that we just have so many resources that it's just not too much of an issue.
No, and that's fascinating. You say that so many people adopt from the shelter because nationally only 27% of people acquire their cats through shelters, animal shelters.
Wow.
Almost 50% are from friends and family. And then the rest are from pet shops or breeders or one of that crowd. So there's a large population of repurposing our cats, or rescuing them. I'll put that in air quotes, rescue out there. And we try to encourage folks that if they have a cat in their backyard and they don't know who belongs to that cat, we have a paper collar template where you can put your own phone number. Does anybody own me? Please call. And so that you can find out. And 80 to 85% of the time, somebody is caring for that cat. And so that cat doesn't get scooped up and put into the sheltering system, because you find out that there is somebody who cares and loves for that cat. And the last thing you want to do is remove that cat from its home environment just because you happen to see, a new cat dropping into the neighborhood. But in these pockets, so you might be like the United Kingdom, where at one point they had 95% of the cats in the community owned cats were spayed or neutered. And at that point in time, all of the colonies were eliminated over time. Now they're having access to care issues. Their sterilization rates are down to 87%. And they're starting to see colonies come back up, and they're having to retrain the community to understand that there is trap, neuter, return as an option. But it's really fascinating that so many different pockets that we have, like all around the country, where things are very different for folks. And in New England, we have it comparing to the South and that kind of thing. Speaking of Boulder, maybe this is our ideal world for cats, right? So what is that ideal world for cats in your mind, Dr. Angie?
Oh, the ideal world for cats is where people understand their needs. And I think as a veterinarian for the past almost 20 years, I've watched us really come a long way of trying to just figure out their dietary needs. Like, we got that all wrong at first. And now I think we're course correcting over time. And then we really misunderstood their social needs. And I think we're trying to course correct for that. And then I think now we're trying to understand their living needs. And I'm so happy to see cat videos come about, or people like enclosing their backyards. And I think it addresses a really important mental health and kind of just like biological need for cats. And so I think in this ideal world, we are understanding their needs and also understanding their needs for consent. I think we've come a long ways there. I think so many cats have been mislabeled negatively because people just don't understand that you have to get your cat's consent if you want to have a partnership with them. Whether they're living in the community, whether they're living in your home, whether they're in my exam room, consent is really important. So I think understanding cats is ideal.
Jojo, what are your thoughts on this?
Well, one, I think Angie just nailed that. She covered that beautifully in terms of the language. And with cats, when we talk about underserved community, that's where I feel that we can continue to improve. I think about the academic or the scientific aspect of it, in which dogs have just had the heavy studies. And it reminds me of the human world, where all of our medications and all of our treatments are based on male bodies. And I feel it's kind of, if you put that into the context of dog, cat, all cat treatments and diagnostics, all the things are based on canine bodies. And so I feel like that's where we are playing some catch up. And I think that there's some attention there that is so deserved and needed. And I'm so excited to see what happens for these kitties who get the research that they deserve.
Yeah. And supposedly it's Year of the Cat. I think we can work hard and we'll make it the Decade of the Cat, right?
They need it. Yeah.
So yeah, it's very important that we bring cat wellness, cat involvement in our society, bring it up a notch. So many of our TNR caregivers and our cat caregivers feed in the dark. They shelter in the hiding places. They want us not to know that they're there. And I get that for part of it, but I also feel like it's done out of fear rather than acknowledging that we believe that TNR and appropriate sheltering, caring for those cats is something to be celebrated and loved and brought forward. I have been in some communities where they have done trap, neuter, return in a commercial area. and you'll see the feeding stations there and like a little sign on the side saying, if you see Butch, this is Butch's feeding station in his little house, and don't pet him because he might bite you if he's there and whatever. But, it's educational and understanding that a cat has a designated spot, a designated place, and that we're caring for those cats and giving them the resources that they need to have, as well as those that care and worry about them, worrying about end of life for a community cat, which in many cases is the cat wandering off and not being seen again. And how do we handle that? How do we understand that that is something that is very different than the end of a dog's life, most likely? I know both of you obviously have dealt with the end of life for cats very often. Is there anything that you would like to share with our listeners? And I'm going to direct it first to Jojo. Is there anything that you would like to share with our listeners, about some of those challenges when it is time to say goodbye to our cats?
I like to speak to that time of life. It's challenging, but also the most beautiful, in my opinion, because to have loved that cat and to have that reciprocal relationship, I do believe we can have conversation in terms of how is your quality of life? I feel like it's a conversation with the cat. Are you tired? What can I do to offer this ease of suffering? And I think as challenging and painful and heartbreaking it is to be in that moment, it's also the most beautiful. And so I think if we can just look at the richness of the gift that we are able to provide, that's how I like to approach end of life. And when it's our own cat, it's much more challenging than what I'm speaking to. I just want to acknowledge it's not so simple, but it's a conversation of love.
Angie, do you want to add anything?
Yes. End of life it's kind of a roller coaster. At least it can be most of the time. Most cats deteriorate as senior kitties, and they don't necessarily have to. We're getting better with things that we can offer them. But cats have this tendency to deteriorate very slowly. And so maybe they get a diagnosis of kidney disease, but that lasts for years, or maybe they start losing weight. And so I feel like the senior years of cats can be really lengthy and very emotional. And I think at the very end, it can be a roller coaster, and it's up and down and up and down. And as the guardian and the caregiver of that cat, it can be really confusing to know how to help. And I always tell people, you don't have to worry about when it's the right time to make the decision, because the decision always makes itself. And so at the end, when you're like, is today the day? And then there's a lot of anxiety about, well, what if I'm doing it too soon or too late? Or, a lot of times I just try to get people to relax a little bit more and know that your cat's going to tell you, and the decision will be made.
So true. One last topic that I'd like to cover before we close out is an understanding that I perceive that if I'm bringing my cat into any veterinarian, I'm going to get a certain level of care sort of in the back room, or I'm going to be back there with the cat, and I may have certain expectations. And I want to put it out there to the community cat group that we need to work very carefully to be careful with our words that we use with our veterinarians, with our veterinary nurses, because veterinary care is very diversified, coming from the emergency clinic to the home office visit to the private practice. I just want to put out there to say that these are human beings that are behind the veil of veterinary medicine, and they have feelings and they have emotions and they care about animals. And we have emotions and feelings, and we're extremely passionate about these cats that we are caring for outside. And when we're bringing them into the practice, we need to bring them in with a level of grace and with kindness and with understanding that everybody is doing the best that they can at that particular time. And sometimes it's at a point when the practice is overwhelmed and overloaded with 5 different emergencies, along with standard appointments going on. And so it is not productive for us to let our emotions show. If we're going to explode, go in the parking lot. Don't bring it into the practice. But I just want to share and acknowledge that we in the community cat space, we're going to try our best to be considerate of the emotions of those in the veterinary practice, because you are all as stressed out as we are. And I don't know, Dr. Angie, if you have any comments on that.
Yes. Absolutely. And this is hard because people come to us because either their cat is sick or they're scared or something's happening, unless it's your well visit. You're coming to see me because things aren't going well. And I think it's hard when people become angry with my, the reception staff or my nursing staff. And it's so easy to turn that fear into anger. And we get it as fellow human beings. But what would be easier is if you cried or you told us you were scared. That's received so much better. And sometimes it's so hard because we're in this with you. And like you said, sometimes, we have 3 other rooms, maybe with other things going on that are awful, or we're short-staffed or something's going on. And we're really trying to do the right thing for everybody in the practice. And so the more grace you can have. And we want to know that you're scared, and we want to reassure you. If you are in this field, it's because you love animals and you have a kind heart. I promise no one's in it for the money. And we care about you too. And so the less anger, the better. And if you are having an emotional moment, we're going to help you. And your animal's going to get better care if you're not mean to us. Because when things start to become unkind and that anger turns towards us, it actually just isolates you from us. And then that negatively impacts your pet. And so, be vulnerable with us. Cry. Don't be mean. Jojo?
Yeah, I want to clarify on that, Angie, because I wouldn't want listeners to hear that if you're angry, your pet is getting worse care because we're mad at you. It would be getting less care because we're stressed. Like, your anger toward us is really stressful, but we are definitely going to treat your cat with the utmost respect and care that it requires. I just wanted to clarify that because I didn't want it to land in any kind of way. And emotion is welcome, right? It's stressful. This is something that you really care about. It can be financially stressful. On top of it's just a stressful environment. You don't know what's happening. I think behind the wall kind of thing, when they take your cat behind the door and you don't know what's happening, adds an extra layer of stress. And so I just invite people to ask the questions, bring your emotion. It is anger that tends to break me. And they will say that it's mental health and veterinary medicine is not because of the euthanasias that we're providing or the stressful emergency surgeries or the sick animals. It's most of mental health breakdowns in veterinary medicine are from clients who treat us poorly. And so I would just say, come with the kindness and together we'll get through this.
Agreed. Absolutely. No, your cat's never getting poor care. I
just thought there was just this little minute and I'm like, oh, somebody might just think.
Yes. Yeah.
You can be mad. We're not going to treat your cat any differently if you're mad.
It's just you get a little bit frozen, and it will extend the process. It'll make everything be a little bit longer.
It's disruptive and a little bit paralyzing.
Right. And then you work through it. You have to stop and say, let's work through this issue. And then you have to go back. And so I just wanted to put out there that this is a difficult conversation because we're trying to do this wonderfully magical dance between caregiver and veterinarian with an owned cat, a community cat that have equal amount of love applied to them. And as you say, it can be with cats because folks don't bring cats in for regular checkups as often as they bring dogs in. So it can tend to be when the emergency happens is when people are seeing the cats. And it is stressful. And then you don't have that relationship established. So I guess the little plug I'll put in is that one of the reasons to develop a consistent relationship with the same veterinarian is that then you have that level of I know, like, and trust you. Where if I'm coming into somebody I've never met before, do I know, like, and trust you? So trying to establish a regular connection with a veterinarian or a veterinary practice is probably wise. All right. So if folks are interested in finding out more about your podcasts, I also know that you do have a website too. Where would they find you, Jojo?
Our podcast is called Tales of Truth, the Truth About Veterinary Medicine, and that's anywhere you can stream your podcast and on YouTube. And then we just launched a new website, so it's all provide right now. And that's www.boulderholisticvet.com.
Excellent. Dr. Angie, is there anything else you'd like to share with our listeners today?
I would just like to encourage everyone to keep pushing for cats to have a better existence. Let's keep understanding our cats, and the future is feline.
The future is feline. I see a tagline there. I do. Jojo, anything else you'd like to share?
I think that I appreciate what you're doing, Stacy, out in the world and those that are in the community. And I just want to say the language. I noticed that coming into this podcast, I really started thinking about language and how language lands from calling a cat stray to feral to community cat. And as soon as I landed on community cat, I was like, oh, this is softness and need to caretake. And so I think what you're doing is great in terms of just changing the language. Starts there.
Well, I appreciate that, Jojo. And Dr. Angie, I want to thank you so much for spending time with me today and being a guest on my show. And I hope we'll have you on again in the future.
I would love that.
That's it for this week. Please head over to Apple Podcasts and leave a review. We love to hear what you think, and a 5-star review really helps others find the show. You can also join the conversation with listeners, cat caretakers, and me on Facebook and Instagram. And don't forget to hit follow or subscribe on Spotify, Apple Podcasts, Google Podcasts, YouTube, Stitcher, or wherever you listen to podcasts so you don't miss a single show. Thanks for listening, and thank you for everything that you do to help create a safe and healthy world for cats.